Under the spotlight this World Mental Health Day, how to overcome the stigma around mental illness and better support its spectrum of conditions. These were among recurring themes at this year's CNA Leadership Summit on mental health at work. The summit is part of a Mediacorp initiative for leaders to share views on issues facing Singapore and the region. Aslam Shah with this report.
From everyday stress to mental fragility linked to risk factors to diagnosed mental illness, conversations on mental health need to be normalized. And to overcome the stigma around mental illness, Senior Minister of State for Health Dr. Janil Puthucheary says attitudes and behaviours need to change.
We will need to continue conversations on mental well-being and encouraging ground-up activities promoting well-being in the community. There was a sense that just being aware and having more information about mental health conditions does not in and of itself reduce the stigma and the attitudes. The shift in attitudes will not happen simply because we provide more information or if we instruct that this is the right way to behave.
Mediacorp CEO Tham Lok King, who opened the summit, says the national broadcaster is in a unique position to spotlight the importance of mental health across its platforms. Launched during the pandemic, this fourth edition of the summit drew its highest physical audience to date. Reflecting growing concerns around mental health, especially in this post-pandemic world, this summit has attracted some 170 attendees from sectors including automotive, food and beverage, and insurance. They're here not just to spotlight on issues, but also to share ideas and solutions on mental well-being, especially in the workplace. And when it comes to tackling an issue that affects just about everyone across sectors, participants weighed in on what they felt were most important.
To instill a family-like culture within a company so that everyone can feel the openness and willingness to share their problems, like how it is in a real family situation.
If we learn to communicate better, if we learn how to work with one another better, and if we learn to be a little bit more compassionate with each other, then a lot of the issues surrounding mental health and our ability to embrace different types of people who might be facing mental health issues and so on, will then become a lot easier.
There were also calls for support within the workplace to shift away from a one-size-fits-all model to a more customized and tailored approach.
Community nurses making their rounds are now also on the lookout for residents who may have mental health needs. Together with community partners, they have helped around 100 such patients since Tan Tock Seng Hospital rolled out the pilot 1 year ago. Sherlyn Sia tells us more.
Besides checking the vitals of a discharged patient, TTSH's community health team also makes a note of his mental well-being.
We look into how their mood, their behavior, and the interaction with us as well as their caregivers, and whether there's any red flags, things that is affecting their day-to-day living.
The nurses then discuss these cases with doctors, including the best course of action. Medication or social support may be recommended. The aim is to better integrate care, as those with chronic conditions often have mental health issues too.
Majority of the cases that we do see are usually those with depression, with anxiety, and in fact quite a number with adjustment issues to this new diagnosis, as well as all the new medications as well. So therefore this may affect their mood and affect their motivation to get better.
And it's not just patients who are transitioning from hospital to home that the team looks after. Around 3 in 10 patients under the care model are referred from community partners. And that's when social workers or volunteers make their own rounds to check on residents and spot those who may have mental health conditions. For example, Madam Lu's 86-year-old mum was assessed to have a delusional disorder during one of these visits.
She got a strong belief that someone is trying to take over the house and also to kidnap her or kill her. That makes her doesn't want to go out at all. The most challenging part is to bring her out to see a doctor. It's great that this healthcare team is in to help us, and after medication she actually did see improvement. She actually calmed down around like 30%.
Madam Lu's mum was referred to TTSH by a team from the Silver Generation Office. That's the outreach arm of the Agency for Integrated Care. It has 20 offices around the island which looks out for seniors and connects them to the right care.
And basically, you can see the numbers of seniors increasing in terms of, from healthy to frail to now, sitting wheelchair. And basically, I think mentally will be affected. Those that are more serious and need long-term care, and basically these are, the support is quite important moving forward.
And with more seniors living alone these days, efforts are also being made by TTSH, AIC and some other 80 community partners to expand support services in various neighbourhoods.